If you woke up this morning and felt like someone had replaced your joints with rusty door hinges that creak and protest with every movement, you are not alone. If you sat on the edge of your bed for those extra few precious minutes, not because you wanted to savor the morning, but because you needed to mentally prepare yourself for that first sharp stab of pain that comes when your feet hit the floor, this message is for you. If you have watched your hands become strangers to you, fumbling with tasks that used to be as natural as breathing, if opening a simple jar has become a monumental challenge that fills you with frustration and embarrassment, then what I am about to share with you could change everything about how you experience your body starting today. My name is Dr. Lauren Mitchell, and I have spent over 2 decades studying joint health and pain management. I have worked with thousands of patients who thought they were condemned to a life of increasing stiffness and discomfort. People who had been told that arthritis pain was simply an inevitable part of aging that they would have to learn to accept. But what I discovered in my research completely challenged everything the medical community believed about joint pain and our body's capacity for healing. What I am about to show you is a simple 1-minute massage technique that can instantly release the tension and stiffness that has been stealing your freedom and comfort. A technique so effective that many of my patients report feeling relief within seconds of trying it. But before I reveal this powerful method, I need you to understand something crucial about your arthritis that your doctor has probably never explained to you. The pain and stiffness you feel every morning is not actually caused by wear and tear on your joints as you have been told. The real culprit is something called fascial restriction, a condition where the thin connective tissue that surrounds every muscle, joint, and organ in your body becomes tight and inflexible, creating a web of tension that pulls on your joints and creates the sensation of stiffness and pain that you experience as arthritis. Think of your fascia like a wetsuit that covers your entire body. When this wetsuit becomes tight and restricted, it compresses everything underneath it, including your joints, muscles, and blood vessels. This compression reduces blood flow to your joints, limiting the delivery of nutrients and oxygen that your cartilage needs to stay healthy and flexible. At the same time, the restricted fascia creates adhesions, sticky areas where the tissue becomes glued together, further limiting your range of motion and creating those sharp pains you feel when you try to move in certain directions. The fascinating thing about fascial restriction is that it can be reversed quickly and dramatically with the right approach. Unlike cartilage damage, which conventional medicine tells us is permanent and progressive, fascial restrictions can be released in minutes using specific pressure and movement techniques that most doctors have never learned about. This is why so many people experience immediate relief when they discover the right way to address their fascial system, and why traditional treatments that focus only on the joints themselves often fail to provide lasting relief. The 1-minute massage technique I am going to teach you today targets the specific fascial restrictions that create the morning stiffness and joint pain that has been disrupting your life. This technique was developed by combining ancient pressure point therapy with modern understanding of fascia and lymphatic drainage. It works by applying precise pressure to key areas of your body that act like master switches for your entire fascial system. When you stimulate these points in the right sequence, you send a signal throughout your fascial network that triggers a release response, instantly improving circulation and reducing tension throughout your entire body. The beauty of this technique is its simplicity. You do not need any special equipment, you do not need to contort your body into uncomfortable positions, and you do not need someone else to help you. You can perform this massage while sitting on the edge of your bed, standing in your bathroom, or even while sitting in your favorite chair. The entire sequence takes less than 60 seconds to complete, and you can repeat it as many times throughout the day as you need to maintain comfort and mobility. Before we begin, I want to address something that many of my patients struggle with. If you have been living with arthritis pain for months or years, you may have developed a protective response where you unconsciously tense your muscles and limit your movements to avoid triggering pain. This protective response, while understandable, actually makes your fascial restrictions worse over time by creating additional areas of tension and reducing blood flow even further. As you begin to use this massage technique, you may notice that your body wants to resist the movements at first. This is completely normal and will diminish as your fascia begins to release, and your nervous system learns that movement can be comfortable again. The first component of this massage focuses on what we call the cranial fascial release point. This point is located at the base of your skull where your neck meets your head. Place the fingertips of both hands at the base of your skull, right where you can feel the edge of your skull bone. Apply gentle but firm pressure with your fingertips and hold for 10 seconds while taking slow, deep breaths. You should feel a subtle pulsing sensation under your fingertips. This point is connected to the fascial network that runs down your entire spine and into your pelvis, so releasing tension here creates a cascade effect throughout your whole body. Next, we move to the cervical fascial gateway, located on either side of your neck about 2 inches below your ears. Using your thumb and first 2 fingers, gently pinch the muscles on both sides of your neck simultaneously. Apply steady pressure for 10 seconds, then slowly roll your shoulders backward 3 times while maintaining the pressure. You may feel a warm sensation spreading down your arms and into your hands as circulation improves and fascial restrictions begin to release. The third step targets the thoracic outlet, a critical area where major blood vessels and nerves pass through your upper chest and shoulder area. Place your right hand on your left shoulder, where your neck meets your shoulder blade. Apply firm pressure with your palm and slowly rotate your left shoulder forward, up, back, and down in a complete circle. Repeat this 3 times, then switch sides and repeat with your left hand on your right shoulder. This movement helps release restrictions that can compress the blood vessels and nerves that supply your arms and hands, often providing immediate relief from morning stiffness in your fingers and wrists. Now we address the lumbar fascial junction, a key area where your lower back meets your pelvis. Place both hands on your lower back, just above your hip bones, with your thumbs pointing toward your spine. Apply firm pressure with your thumbs and slowly bend forward about 20 degrees. Hold for 5 seconds, then return to standing. Repeat this movement 3 times. This releases fascial restrictions in your lower back that often contribute to hip and knee pain by creating compensatory movement patterns. The fifth component focuses on the pelvic fascial ring, which affects circulation and nerve function to your entire lower body. While standing, place your hands on your hips with your thumbs pointing toward your back. Apply firm pressure with your thumbs and slowly rotate your hips in a complete circle, first clockwise 3 times, then counterclockwise 3 times. Keep your upper body stable and let the movement come from your pelvis. This helps release restrictions in the fascial network that surrounds your pelvis and can dramatically improve mobility in your hips, knees, and ankles. Finally, we complete the sequence with the peripheral circulation boost. Extend both arms out to your sides at shoulder height. Make loose fists and rapidly shake your hands for 10 seconds, as if you are trying to shake water off your fingers. Then point your toes and rapidly flex and point your feet 10 times. This final step helps pump freshly oxygenated blood into your extremities and clears any stagnant lymphatic fluid that may have accumulated overnight. When performed as a complete sequence, this massage technique creates what we call a fascial release cascade, where the release of tension in one area triggers relaxation throughout the entire fascial network. Many of my patients report feeling an immediate sense of lightness and freedom of movement that they have not experienced in years. The key is consistency and mindfulness. Perform this sequence every morning as soon as you get out of bed, and again in the evening before you go to sleep. You can also use individual components throughout the day whenever you notice stiffness beginning to return. I want to pause here and acknowledge something that many of you watching this are probably feeling right now. You have tried so many things before, spent so much money on treatments and therapies that promised relief, but left you feeling disappointed and even more hopeless than before. You have been told by well-meaning friends and family members to just stay positive, to accept your limitations, to be grateful for what you still can do. But I know that somewhere deep inside, you have never stopped believing that your body has the capacity to feel better, that the pain and stiffness you experience every day does not have to be your permanent reality. What I want you to understand is that your instinct is absolutely correct. Your body does have remarkable healing capacity, even if you have been living with arthritis symptoms for years or decades. The fascial system I have been describing is incredibly responsive to the right kind of stimulation. Unlike cartilage, which heals slowly, or bone, which requires weeks to regenerate, your fascia can change its tension and flexibility in minutes. This is why people often experience such dramatic and immediate improvements when they learn to work with their fascial system instead of against it. Let me share with you what happened with Patricia, a 67-year-old retired teacher from Phoenix who came to my clinic after living with severe morning stiffness for over 8 years. Patricia told me that she had stopped making breakfast for her husband because the pain in her hands was so severe that she could not grip the handle of the coffee pot or turn the burner knobs on their stove. She had tried multiple medications, attended months of physical therapy, and even considered joint replacement surgery for her hands. When I taught her this massage technique, she was skeptical but agreed to try it for 1 week. 3 days later, Patricia called my office crying. She had just made her husband his favorite pancake breakfast for the first time in over 2 years. Her hands felt so much better that she was able to grip the mixing bowl, flip the pancakes, and even open the sticky syrup bottle that had been sitting unused in their pantry because she could not manage the cap. But what touched me most about Patricia's story was what she said next. She told me that as she watched her husband's face light up when he saw those pancakes on his plate, she realized that she had not just gotten her hand function back, she had gotten a piece of herself back, a part of her identity as a caring wife that arthritis had slowly been stealing away. 6 months later, Patricia sent me a photo of herself kneading bread dough for her granddaughter's birthday party. In her note, she wrote that people keep asking her what medication she is taking or what surgery she had because the difference in her mobility and energy is so dramatic. When she tells them about the massage technique, they often look skeptical, as if something so simple could not possibly work where expensive treatments had failed. But Patricia knows better now. She understands that her body was never broken beyond repair. It just needed someone to show her how to work with its natural healing mechanisms instead of fighting against them. Another patient, Robert, a 59-year-old mechanic from Detroit, had been forced to leave his job because arthritis in his knees and hips made it impossible for him to crouch down under cars or climb up to work on truck engines. Robert had always prided himself on his physical strength and capability, and losing his career to arthritis had sent him into a depression that affected every aspect of his life. His wife told me that he had become withdrawn and irritable, spending most of his time in his recliner, afraid to make plans because he never knew how bad his pain would be on any given day. When Robert first tried the massage technique, he admitted that he did not believe it would work. He had been told by multiple doctors that his joint damage was too severe, and that his only options were strong pain medications or eventual joint replacement surgery. But Robert was desperate enough to try anything, and his wife encouraged him to give it a chance. Within 2 weeks of performing the massage sequence twice daily, Robert noticed that he could get out of his chair without wincing, and that the sharp pain in his knees had softened to a dull ache that he could easily ignore. After a month, Robert decided to test his progress by helping his neighbor replace a water heater. He spent 3 hours crouching, lifting, and maneuvering in tight spaces, fully expecting to pay for it with days of increased pain. Instead, he felt energized and accomplished, with only mild stiffness that disappeared completely after his evening massage routine. 6 months later, Robert returned to work part-time at a different shop, and he recently told me that he feels stronger and more capable now than he has in over 5 years. What Robert discovered, and what many of my patients come to understand, is that the conventional approach to arthritis treatment often overlooks the body's incredible capacity for adaptation and healing. When we focus only on managing symptoms with medications or replacing joints with artificial ones, we miss the opportunity to address the underlying fascial restrictions that are often the real source of pain and stiffness. By learning to release these restrictions regularly, people like Robert can often avoid surgery entirely and return to activities they thought were lost forever. The massage technique I have shared with you today is based on principles that have been used for thousands of years in traditional healing systems around the world. Ancient Chinese medicine understood that the flow of energy and blood through the body could be improved by stimulating specific points and pathways. Traditional Thai massage developed sophisticated techniques for releasing fascial restrictions through pressure and movement. Indigenous healing traditions from cultures across the globe recognize that the body's connective tissue holds emotional and physical tension that must be released for true healing to occur. What makes this approach so different from conventional arthritis treatment is that it works with your body's natural healing mechanisms instead of trying to override them. Pain medications may temporarily mask your symptoms, but they do nothing to address the fascial restrictions that are causing your pain. In fact, long-term use of anti-inflammatory medications can actually impair your body's natural healing processes and lead to digestive problems, cardiovascular issues, and increased risk of falls due to dizziness and cognitive effects. Physical therapy, while often helpful, typically focuses on strengthening muscles and improving joint mobility without addressing the fascial system that connects everything together. This is why many people experience temporary improvement during their therapy sessions but find that their symptoms return once they stop attending appointments. By learning to release your fascial restrictions yourself, you gain the power to maintain your improvement independently and respond quickly whenever stiffness begins to return. The 1-minute massage technique works because it addresses the root cause of your symptoms rather than just managing their effects. When you release fascial restrictions, several important things happen simultaneously. First, blood flow to your joints improves dramatically, delivering the nutrients and oxygen that your cartilage needs to stay healthy and repair minor damage. Second, lymphatic drainage increases, helping to remove inflammatory substances that have been accumulating in your joint spaces. Third, nerve function improves as compressed nerves are released from fascial adhesions that have been interfering with their normal signaling. Perhaps most importantly, releasing fascial restrictions helps restore normal movement patterns throughout your body. When you have been living with pain and stiffness for months or years, your body unconsciously develops compensatory movement strategies to avoid triggering discomfort. These compensations create additional areas of tension and restriction, leading to a downward spiral, where pain and dysfunction spread to areas that were previously healthy. By restoring normal fascial flexibility, you break this cycle and allow your body to return to its natural, efficient movement patterns. I want to address a concern that many people have when they first learn about this technique. Some of my patients worry that if their relief comes from something as simple as a 1-minute massage, their arthritis must not have been real or serious. This kind of thinking reflects the harmful misconception that effective treatments must be complex, expensive, or painful to be valid. The truth is that the most profound healing often comes from simple interventions that work in harmony with your body's natural processes rather than fighting against them. Your arthritis symptoms are absolutely real, and the pain and limitation you have been experiencing should never be minimized or dismissed. What this technique demonstrates is that your body has more capacity for improvement than you may have been led to believe. The fascial system is incredibly responsive to the right kind of stimulation, and releasing restrictions that may have been building up for years can happen much more quickly than most people expect. It is also important to understand that while this massage technique can provide dramatic relief for many people, arthritis is a complex condition that may require a comprehensive approach for optimal management. The fascial release technique should be seen as a powerful tool in your self-care toolkit, not as a replacement for appropriate medical care when needed. If you have severe joint damage, active inflammation, or other serious health conditions, you should always work with qualified healthcare providers to develop a complete treatment plan. However, what I have seen in my practice is that when people learn to manage their fascial restrictions effectively, they often find that they need less medication, experience fewer flare-ups, and maintain better function for longer periods. Many of my patients have been able to delay or avoid joint replacement surgeries by incorporating fascial release techniques into their daily routines. Others have found that they can participate in activities and exercise programs that were previously too painful to consider. If you have been following along and trying the massage technique as I described it, you may already be noticing some changes in how your body feels. Some people experience immediate relief, while others notice gradual improvement over the first few days or weeks of consistent practice. There is no right or wrong timeline for improvement, and your body's response will depend on factors like how long you have been experiencing symptoms, your overall health status, and how consistently you perform the technique. What I can tell you is that the people who get the best results from this approach are those who commit to making it a regular part of their daily routine. Just like brushing your teeth or taking a shower, fascial release works best when it becomes a habitual part of your self-care practice. The technique is designed to be quick and convenient so that you can easily fit it into your existing schedule without adding stress or complexity to your day. Many of my patients find it helpful to perform the morning sequence immediately after getting out of bed, before they get dressed or start their other morning activities. This ensures that they address any stiffness that has accumulated overnight before it has a chance to affect their entire day. The evening sequence can be done while watching television, listening to music, or even as part of a bedtime relaxation routine. I also encourage people to pay attention to their body's signals throughout the day and use individual components of the technique whenever they notice tension beginning to build up. For example, if you have been sitting at a desk for several hours and notice stiffness in your neck and shoulders, you can quickly perform the cranial fascial release and cervical fascial gateway steps to restore comfort and mobility. If you have been standing or walking for extended periods and feel tension in your lower back and hips, the lumbar fascial junction and pelvic fascial ring steps can provide immediate relief. One of the most rewarding aspects of my work is witnessing the transformation that occurs when people discover they have more control over their pain and function than they ever imagined possible. I have seen patients who had resigned themselves to a life of increasing limitation suddenly begin making plans again, signing up for activities they had given up, and rediscovering parts of themselves that arthritis had forced into hiding. Margaret, a 72-year-old grandmother from Minnesota, told me that after 6 weeks of using the massage technique, she was able to get down on the floor to play with her granddaughter for the first time in 3 years. She described the joy of seeing her granddaughter's face when she joined her in building a puzzle on the living room carpet, and how that simple moment reminded her that she was not just a grandmother watching from the sidelines, but an active participant in her granddaughter's childhood. James, a 54-year-old teacher from California, shared that the massage technique helped him return to his weekend hiking hobby after nearly 2 years of avoiding the trails he loved. He said that being able to explore nature again did not just improve his physical health, but restored his sense of adventure and optimism about the future. James now leads hiking groups for other people with arthritis, showing them that their condition does not have to define the boundaries of their lives. These stories illustrate an important truth about healing that goes beyond just reducing pain or improving mobility. When you regain control over your physical symptoms, you also reclaim parts of your identity and your dreams that may have been dormant for years. The massage technique I have shared with you today is not just about managing arthritis. It is about reclaiming your life, your confidence, and your sense of possibility. As you begin to incorporate this technique into your daily routine, I want you to pay attention not just to changes in your pain levels or stiffness, but also to changes in your mood, your energy levels, and your willingness to engage in activities you enjoy. You may find that as your physical symptoms improve, you also feel more optimistic, more social, and more willing to make plans for the future. This is not a coincidence, but a natural result of breaking the cycle of pain and limitation that has been constraining your life. I also want to encourage you to be patient and compassionate with yourself as you explore this new approach to managing your arthritis. If you have been living with chronic pain for a long time, your nervous system may have become hypersensitive, causing you to anticipate pain even when it is not present. It may take some time for your brain to adjust to the new signals it receives from your body as your fascial restrictions begin to release and your movement patterns improve. Some people experience what we call a healing response in the first few days of using the fascial release technique. This might involve temporary increased awareness of sensations in your body as circulation improves and nerve function normalizes. You might feel tingling, warmth, or even brief increases in stiffness as your body adjusts to its new state of balance. These responses are generally mild and temporary, but they are a sign that your body is responding to the treatment and beginning to heal. If you experience any concerning symptoms, or if your pain significantly worsens after trying the technique, you should discontinue the practice and consult with a healthcare provider. While the massage technique is designed to be safe and gentle, everyone's body is different, and what works well for most people may not be appropriate for everyone. For the vast majority of people, however, this technique provides a safe, effective way to address the fascial restrictions that contribute to arthritis pain and stiffness. The key is consistency and patience, allowing your body the time it needs to release restrictions that may have been building up for years. Remember that healing is rarely a linear process, and you may have good days and challenging days as your body finds its new balance. I want to take a moment to address something that many people with arthritis struggle with, something that often goes unspoken in medical appointments and support groups. Living with chronic pain can create a profound sense of isolation and disconnection from your own body. You may have reached a point where you feel like your body has betrayed you, where you no longer trust it to support you in the activities and adventures you want to pursue. This feeling is completely understandable and more common than you might realize. When pain becomes a constant companion, it is natural to begin to see your body as an adversary rather than an ally. The massage technique I have shared with you today offers an opportunity to begin rebuilding that relationship with your body, to discover that it still has remarkable capacity for comfort, flexibility, and strength. As you practice the fascial release sequence, try to approach it not as something you are doing to your body, but as a conversation you are having with it. Pay attention to how it responds to your touch. Notice areas that feel particularly tight or tender, and appreciate the immediate feedback you receive as tension begins to release. This mindful approach to the technique can help you develop a new appreciation for your body's wisdom and resilience. Many of my patients tell me that learning to perform the massage technique helps them feel more connected to their body in a positive way for the first time in years. Instead of experiencing their body primarily as a source of pain and limitation, they begin to see it as a partner in their healing journey, capable of change and improvement with the right support and attention. This shift in perspective can be just as important as the physical relief the technique provides. When you stop seeing your arthritis as a life sentence and start seeing it as a challenge that can be managed and improved, you open yourself up to possibilities that may have seemed impossible just weeks or months before. Before I share some additional strategies that can enhance the effectiveness of your fascial release practice, I want to acknowledge the courage it takes to hope again after you have been disappointed by treatments that promised relief but failed to deliver. If you are watching this video, you have probably tried numerous approaches to managing your arthritis, and some of them may have left you feeling more frustrated and hopeless than when you started. The fact that you are here, willing to try something new, willing to believe that improvement is possible, demonstrates incredible strength and determination. That willingness to keep searching for solutions, to refuse to accept limitation as your permanent reality, is one of your greatest assets in your healing journey. Hold on to that hope and let it fuel your commitment to giving this technique a fair trial. Now, let me share some additional strategies that can amplify the benefits of your daily fascial release practice. The first is proper hydration, which plays a crucial role in maintaining healthy fascia. Your fascial tissues are largely composed of water, and when you are dehydrated, they become sticky and less flexible, making restrictions more likely and more persistent. Aim to drink at least half your body weight in ounces of water throughout the day, and consider adding a pinch of high-quality sea salt to your water to improve cellular hydration. The second enhancement involves timing your massage practice with your body's natural rhythms. Your fascial system is most responsive to release techniques in the morning when your body is transitioning from the rest and repair mode of sleep to to the active mode of daytime. This is why the morning sequence can be so dramatically effective at setting the tone for your entire day. Similarly, the evening sequence helps your body transition back into rest mode, promoting deeper sleep and more effective overnight healing. Temperature can also play a role in optimizing your results. Some people find that performing the massage sequence after a warm shower or bath enhances the release response, as heat helps soften fascial tissues and improve circulation. Others prefer to use the technique when their body is at room temperature, as they feel more sensitive to the subtle changes that occur during the release process. Experiment with both approaches and use whichever feels most effective for your body. Breathing patterns during the massage sequence can significantly influence your results. Slow, deep breathing activates your parasympathetic nervous system, which promotes relaxation and healing throughout your body. Try to coordinate your breathing with the pressure and movement of each step, inhaling as you apply pressure and exhaling as you release it. This conscious breathing pattern helps amplify the relaxation response and can make the entire sequence more effective. If you are dealing with particularly stubborn restrictions or areas of chronic tension, you might benefit from spending extra time on specific components of the sequence. For example, if your hands and wrists are your primary problem areas, you could perform the cervical fascial gateway step multiple times throughout the day. If hip and knee stiffness is your main concern, focusing additional attention on the lumbar fascial junction and pelvic fascial ring steps could provide enhanced relief. Some of my patients have found it helpful to keep a simple journal tracking their daily pain levels, stiffness ratings, and functional improvements as they begin using the massage technique. This record can help you identify patterns in your symptoms and document your progress over time. Many people are surprised to realize how much improvement they have experienced when they look back at their entries from just a few weeks earlier. It is also worth noting that the benefits of fascial release often extend beyond just arthritis symptoms. Many of my patients report improvements in sleep quality, energy levels, mood, and even digestive function as their fascial restrictions release and their overall circulation improves. This makes sense when you consider that the fascial system connects every part of your body, and releasing restrictions in one area can have positive effects throughout your entire system. As you continue to use this technique over the coming weeks and months, you may find that you become more aware of subtle changes in your body that you previously overlooked. You might notice that certain activities, foods, or stress levels affect your fascial tension and arthritis symptoms. This increased body awareness is actually a sign of healing, as your nervous system becomes more finely tuned to your body's needs and more responsive to your self-care efforts. Some people find that they can prevent flare-ups entirely by recognizing early warning signs of increasing fascial tension and addressing them immediately with the massage technique. Others discover that they can return to activities they had given up by using specific components of the sequence before and after challenging tasks to maintain their comfort and mobility. The key is to remain curious and experimental in your approach, treating the massage technique as a starting point for developing a deeper understanding of your body's unique patterns and needs. Every person's fascial system is different, and what works best for you may be slightly different from what works best for someone else. Trust your body's feedback and be willing to modify the technique as needed to maximize your results. I want to take a moment to talk about something that can be one of the most challenging aspects of recovering from chronic pain. As you begin to feel better, you may experience anxiety about the possibility of your symptoms returning. This is completely normal and understandable. When you have lived with pain and limitation for an extended period, it can feel scary to hope that improvement will last. Some of my patients describe feeling almost afraid to enjoy their newfound comfort and mobility, as if acknowledging the improvement might somehow cause it to disappear. Others worry about overdoing activities they have missed and inadvertently triggering a setback. These concerns are natural, but it is important not to let them prevent you from fully embracing the positive changes you experience. Remember that you now have a tool that you can use whenever you need it. The massage technique gives you a way to actively participate in maintaining your improvement rather than passively hoping that it will continue. This sense of empowerment and control over your symptoms is one of the most valuable aspects of learning to work with your fascial system. As you become more confident in your ability to manage your arthritis symptoms, you may find yourself willing to take on new challenges and set goals that seemed impossible when your pain was uncontrolled. This is one of the most rewarding aspects of my work, watching people rediscover their sense of adventure and possibility as their physical limitations diminish. I encourage you to start small and gradually expand your activities as your confidence grows. If you have been avoiding social activities because you were worried about your mobility, consider accepting an invitation that involves minimal walking or physical demands. If you have given up hobbies because of hand or finger stiffness, try spending just a few minutes engaging in those activities after performing your morning massage routine. The goal is not to immediately return to all the activities you enjoyed before arthritis became a factor in your life, but to gradually rebuild your confidence in your body's ability to support you in the things that bring you joy and fulfillment. Each small success builds on the previous one, creating a positive momentum that can carry you toward larger goals and greater independence. Many of my patients find that as they become more active and engaged in life, their overall health and well-being improve in ways that extend far beyond their arthritis symptoms. Regular movement and social engagement support healthy immune function, cardiovascular health, cognitive function, and emotional well-being. In this way, addressing your fascial restrictions and improving your mobility becomes an investment in your overall quality of life and longevity. I also want to emphasize the importance of celebrating your progress, no matter how small it might seem. If you are able to open a jar without assistance, if you can walk upstairs without gripping the handrail, if you can sit through a movie without constantly shifting to find a comfortable position, these are significant victories that deserve recognition and appreciation. In our culture, we often focus on dramatic, rapid transformations and overlook the importance of gradual, sustainable improvements. But the truth is that lasting healing usually happens incrementally, with small positive changes accumulating over time to create profound shifts in function and quality of life. By acknowledging and celebrating these incremental improvements, you reinforce your commitment to the healing process and maintain motivation during challenging periods. As we near the end of our time together today, I want to make sure you understand that what I have shared with you is not just a technique for managing arthritis symptoms, but an invitation to develop a new relationship with your body based on understanding, compassion, and active participation in your own healing. The fascial release massage is a tool, but the most important element is your willingness to believe that improvement is possible and to take consistent action toward that possibility. If you are someone who has been told that you just need to learn to live with your arthritis, that your pain and stiffness are inevitable consequences of aging that cannot be changed, I hope what you have learned today challenges those limiting beliefs. Your body has remarkable capacity for healing and adaptation at any age, and there are always new approaches and strategies worth exploring. The massage technique I have taught you today represents just one example of how working with your body's natural healing mechanisms can produce results that seem almost miraculous compared to the limited options offered by conventional medical approaches. As you begin to experience the benefits of fascial release, I encourage you to remain open to other natural healing modalities that support your body's innate wisdom and resilience. What I want you to take away from this video is not just the specific steps of the massage technique, although those are certainly important, but a renewed sense of hope and possibility about your health and your future. You are not a passive victim of arthritis or aging, but an active participant in your own healing journey with the power to influence your symptoms and improve your quality of life through the choices you make every day. The path to better health is rarely linear or predictable, and you may encounter setbacks and challenges along the way. But with the right tools, the right mindset, and the commitment to consistent self-care, you can achieve levels of comfort and function that may seem impossible from where you are sitting today. Trust in your body's ability to heal. Trust in your own wisdom and intuition. And most importantly, trust that you deserve to live without constant pain limiting your dreams and possibilities. Thank you for spending this time with me today, and for having the courage to believe that better days are ahead. I hope this technique brings you the relief and freedom you deserve, and I look forward to hearing about your journey toward greater comfort and mobility in the days and weeks to come.